I'm Stuart Williams, publisher of the Journal of Urgent Care Medicine, and today we're talking to Dr. Lee Resnick about Ebola. Dr. Resnick is an accomplished healthcare entrepreneur, educator, and thought leader. He serves as the editor-in-chief of the Journal of Urgent Care Medicine and was also a founding board member and past president of the Urgent Care Association of America. He currently serves as Chief Medical Officer at Wells Street Urgent Care, a network of urgent care centers in the Atlanta metropolitan area. Hello, Lee.
Thanks, Stu.
So, appreciate you speaking with us today. Urgent care centers are obviously on the front lines when it comes to Ebola, and like it or not, they need to be prepared. What advice can you give with respect to this?
Well, it's critically important that we all take an organized, sensible, and realistic approach to this. There's a lot of advice out there, a lot of guidance, but our job is to, as thought leaders, is to interpret and filter this guidance to represent urgent care realities and to protect our staff and patients from unnecessary risk. So to that end, urgent care centers are strongly encouraged to adopt policy and procedure that accomplishes the following goals. Number one would be simplify the identification of at-risk patients. Number two would be to minimize exposure, risk of exposure. Number three would be to reduce anxiety of the staff and the general public. And number four would be to separate fact from fiction. And at the Journal of Urgent Care Medicine, we've worked with experts to create a sample policy and procedure around these goals. And readers can go to the website for more detail. But if you have some more specific questions now.
Sure. So you mentioned the risk of exposure to urgent care personnel. What is that risk?
So direct contact with a sick, symptomatic patient's bodily fluids is the only way to contract Ebola. The healthcare personnel who have fallen ill in this country are those healthcare workers who are directly caring for the sickest patients. These healthcare workers have direct contact with bodily fluids, and experts agree that transmission is most likely when sick patients are in their final days, when viral loads are at their peak and the hemorrhagic sequelae are in full swing. Realistically, only patients in the early phases of disease are likely to present to an urgent care center, and therefore the risk of exposure right from the get-go is far less. Just being in the same room with a patient does not represent an exposure. So to answer your question, Stu, a carefully planned policy and procedure can nearly eliminate exposure risk in the unlikely event a suspected case presented to an urgent care. The fact is the urgent care center really should not be the place where suspected cases are evaluated. This should occur at qualified hospitals with isolation and laboratory capabilities. Therefore, the urgent care role is limited to the identification of at-risk patients who are feeling ill. Once they're identified, contact with the patient is entirely unnecessary. Vitals should not be taken, and history need only be limited.
Okay, so if you work at an urgent care center then, how would you identify an at-risk patient without exposure to yourself?
So the goal here is to keep identification simple. The reality is that any patient with travel to and from West Africa who is feeling ill in any way is an at-risk patient. At-risk patients should not be evaluated in the urgent care. Escort those patients to a room, call the public health department or the CDC, and arrange for safe transfer. The only case where contact with these patients is necessary would be if the patient is unstable. Right. So adequate personal protective equipment, or PPE, should be available and organized so the staff can adequately protect themselves when contact's inevitable. This scenario, however, is extremely unlikely. So to reinforce, once an at-risk patient is identified, no additional information is necessary, so there'd be no direct contact and therefore no risk of exposure. While being prepared is very important, direct contact is only necessary for unstable patients, a highly unlikely event.
Right. Okay, and I also see you're suggesting a pretty general screening criteria for urgent care centers, and wanted to hear your thoughts on why, since the CDC has specific screening questions for Ebola virus disease, why urgent care might have a different screening criteria.
So, good question. The symptoms of Ebola virus disease are vague, and the complaints vary significantly. Also, cultural and language challenges are likely to muddy the waters here and make history taking much more difficult and less precise. As far as I'm concerned, if an at-risk patient is feeling ill in any way, then they are a suspected case and should be further evaluated in a regional health center that is better able to do so safely and accurately. Additional questions or taking temperature and vitals, to me, is unnecessary and just adds to the exposure risk. Right.
Okay. And down the line, any chance that the Ebola virus mutates and becomes airborne?
So this is a common fear and question that's raised, and some have, postulated that this is the case, and this is why these healthcare workers that are directly caring for the sick patients are getting ill despite personal protective equipment. Well, the answer is actually pretty emphatic. While genetic mutations are common for viruses, evolutionary genetics does have its limitations, and viruses that infect certain cells usually only infect those cells. So for Ebola virus, these viruses infect the cells of the circulatory system. They cannot mutate to infect cells of, say, the respiratory system. Right. And because of that, aerosolization of the Ebola virus is infinitely unlikely. The virus can certainly mutate to become more resistant to treatments. It may mutate so that people who have been exposed and developed antibodies would be susceptible again to a mutated virus, but it cannot mutate to the extent of infecting cells from an entirely different system.
Okay, good to know. All right, final question. Where do you suggest urgent care center staff might find up-to-date and urgent care relevant guidance regarding Ebola?
So the Journal of Urgent Care Medicine will be maintaining an updated guidance page on its website that includes a sample policy and procedure that I discussed, and it applies to urgent care realities. We remain in daily contact with experts and are prepared to interpret and filter the latest advice so it's relevant and realistic to urgent cares and urgent care center staff. That's the key. Of course, it's important to know you can't create a policy for every eventuality. Right. And at the end of the day, good clinical judgment is always a priority.
You cut out on that last statement. You stay up to date, and then it totally cut out for some reason. Can we get that?
I cut out when I was asking the question?
No.
I'll start again.
Answer.
Yeah.
Okay.
So I'm just going to start with the answer here, Sean.
Perfect.
The Journal of Urgent Care Medicine will be maintaining an updated guidance page on its website that includes a sample policy and procedure that applies to the urgent care realities that I previously described. We remain in daily contact with experts and are prepared to interpret and filter the latest advice so it's relevant and realistic for urgent cares and urgent care center staff. That's the key here. Of course, you can't create a policy for every eventuality, and good clinical judgment is always a priority.
Terrific. Lee, very enlightening. Thanks so much, and it was great to speak with you.
Thanks, Stu.